Hospital visits can be stressful, inconvenient, and impersonal. Since the 1980s, the United States healthcare system has remained relatively unchanged. Innovation is taking place in almost every other industry except personal wellness.
The healthcare industry has been unchanged for a long time, and a lot of people have tried to innovate and find different ways to improve it, but there's a lot of conflicting interest in it. You've got insurance companies, you've got government, you have CEOs of hospitals, and then obviously you have the doctors, nurses, unions, and at the end, the patients. If you try to only fulfill one of their needs, you'll fail the others. And there's not any one right one we should focus on. You really have to focus on all of them.
In other service-based industries, it has become very consumer-centric. So it's very focused on what does the consumer need to have the best experience possible, make it as convenient as possible. In healthcare, it is a different type of dynamic. It's how many people can we see from the community, get them in through the front door, and get them out through the back door to make more room for more patients to come in. And I think that is where a lot of the stress and a lot of the stagnant behavior in the healthcare system has come from. The patient has to drive themselves when they're not feeling well or injured into a parking lot, and then they have to walk into a waiting room. They have to talk to several people before they actually get to the point person they're trying to get to. From a patient and provider perspective, it's not ideal because there's a lot of red tape in the middle of that access and delivery system happening. So that relationship between the patient and the provider, it's stressed right from the first interaction.
I have 2 small children, and they have frequent ear infections, sick all the time. I have migraines. My husband, had various viral infections, and it would take an entire day to accomplish going into the doctor's office, getting them tested, getting the antibiotics, staying home, and I'm a hardworking tech executive / mother. It's not doable with the kind of job and life that we live.
Hospital visits have long been bogged down with politics and red tape. Fortunately, a migration has begun in medicine. A handful of clinics are emerging to eliminate unnecessary hurdles and get patients more personalized care quicker.
Time is so important in so many things in our life. It's more important than money. So getting the right answers, the right treatment helps save a lot of time. Getting the answers, but also saves time to getting you back to health.
I enjoy being a patient of LX Medical because they were the first people to really think outside of the box. I was having about 15 migraines a month. With my job and my kids, it was just unmanageable. And so I worked with Jim and Andrea on some other alternative solutions, and I got them down to less than, I'd say, 5 a month. The longest streaks that I've had in over 10 years of my migraines was due to them working with me. One of the times that one of the IV specialists came out for one of my worst migraines of my life, he truly saved me. I mean, I was sicker than I've ever been, and he was at my house in 30 minutes. My IV was in a couple, and I felt better within about 20 minutes. It was truly a miracle.
Serving the greater Minneapolis area, LX Medical is evolving the healthcare model. Their concierge-style clinic eliminates insurance involvement and provides the community with a hassle-free, cash-based system. As a member of LX Medical, patients have access to unprecedented 24/7 telehealth, in-home urgent care, and peace of mind.
How can we take ourselves as medical providers and be able to go straight to a patient without any of that red tape in the middle? We started LX Medical simply based on that notion. Let's connect providers to patients, and let's reimagine, let's innovate in that space of how does that access happen, patients accessing medical providers, and how do those medical providers deliver the healthcare services in a completely different way.
We really offer the full span of medicine, and we can do it in the home. Although medicine seems to have been really stagnant, there's been tons of innovation in this space, and we've really been able to adopt a lot of that and bring it into people's homes and give them a lot of answers that they wouldn't typically have. We have a lot of innovative tests that look for ways of preventing illness or early intervention, just like our Gallery test that looks at 50 different cancers, most of which don't have any screening. We also try to treat the full patient and not just numbers or labs? How do we make them really the healthiest, happiest patient and person for themselves and for their families?
It was really important for us to be working during the pandemic because we're an essential provider for Operation Warp Speed, and we needed everybody to be working as many hours as we could and to be as productive as possible, and yet we didn't want to risk the health of employees as well. So I needed quick information, educated information, and that's what they did.
We've created very easy ways for people to connect to providers. They can call and immediately get a medical provider on the phone. There's not a triage person, there's not an administrator, it's not a scheduling fiasco. You get straight to someone who can weigh in on the issue.
In traditional medicine, there's so many hurdles, there's so many different things that the provider has to focus on. They really can't put their focus on the patient. And I really just want to give a platform and a company where providers can go to their core of what they went into medicine for, and that's to help patients and provide really, really good medicine.
Don't struggle navigating the overcrowded medical system anymore. Call, email, or text LX Medical, the right care at the right time.